The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with another edition of the Genuine Article, and I'm talking to Dr. Noel Barry-Mers, who was the chair of a committee recently that developed competence and training statements regarding preventive cardiovascular medicine, a very important topic. Noel is the director of the Preventive Cardiovascular Center at Cedars-Sinai Medical Center. Now, what was the impetus for the development of this competence and training statement, Noel?
Well, Tony, clearly prevention of cardiovascular disease is a top priority, increasing importance over the decades, and now with healthcare reform will be at the top. Number two, it is relevant to essentially all practitioners' lives, including allied healthcare professionals, so very broad-based. And then number three, we really wanted to also focus on leaders in cardiovascular prevention to really maintain our excellent secondary prevention programs, our guidelines, our lipid management, our cardiac rehab. So three important points.
You know, it's interesting to me. I think most of us cardiologists, I'd put myself in that number, kind of think of ourselves as very capable preventive medicine individuals, that we're knowledgeable and that's what we do for all of our patients. But I think what you're alluding to is really a higher level of expertise in prevention.
And that certainly was one component, and you will see that the writers of the guidelines or of this source document were leaders in their areas, particularly in areas of physical activity, nutrition, lipids, diabetes management, hypertension management. And it again acknowledged that we need to have those experts because in addition to being academic experts and doing the research and pushing that ball forward, we really need to distribute these systems of care, and we need experts to provide support to you, the practicing cardiologist, because we now acknowledge that an individual practitioner's knowledge base and their ability to act and write a prescription is a small part of the prevention piece. Issues of guidelines, issues of compliance, issues of nutrition, exercise, lifestyle that are often beyond that of any individual practitioner.
Do you ultimately see this becoming a subspecialty of cardiology with an examination?
We actually didn't, and that was an early issue of quite a lot of debate. But that would do two things that we thought would be detractors to this mission. Number one, it would probably take a lot of primary care physicians and allied healthcare professionals, nurse practitioners, PAs, out of feeling like they were part of the prevention piece. And then number two, it meant that you potentially only had a few experts that really could do this. And that's clearly, I'm a preventive specialist. I probably could take and pass that exam, and yet I can only treat a couple thousand patients at any one time. We're talking about 12 million patients with established cardiovascular disease in the U.S. right now, many more at risk that could benefit from these types of practices. Therefore, competency is really something that any individual healthcare provider should do and could do.
Well, this is a fascinating document. There's 20 areas of expertise. They range from the detection of atherosclerosis by imaging to management of obesity and hypertension to epidemiologic and statistical evaluation to knowledge of genetics and genomics. It's really a wonderful document. I congratulate you very much. I'm going to read it again myself, and I urge everyone else to do that. Thanks a million for being with us.
And it's a great source document, meaning it should be at your fingertips, and many of the sources are online. So we tried to make it very user-friendly. Prevention is everybody's business.
Thanks very much for being with us, Noel. For the Genuine Article, I'm Tony DeMaria.
The Genuine Article. Discussion and commentary based on articles from JACC.